Hi, I am Professor Amitabh Banerjee, author of COVID-19 Pandemic. I am an epidemiologist who had been chronicling the pandemic as it unfolded. And today I'll be discussing chapter 15 of the book COVID-19 Pandemic, Third Eye. Title is Health-Wise Cost of Chasing the Impossible. This was written when, even after community transmission had taken place, the world governments, the health authorities were chasing the virus, contact tracing, quarantine, RT-PCR of close contacts. So this was going on, and I wanted to bring out from the data and from the epidemiological principles how futile this is. How so this is how this is a topic for this chapter. Panic and fear contributed to deaths due to COVID, confirmed peer-reviewed research. And this, I also brought out this type of chasing the virus also led to panic by increasing the case counts, which had no significance actually. Panic and wrong policies also allowed vested interests to push dubious cures and claim 99% efficacy. Because the survival rate was 99%. For any medication, any intervention will have at least a 99% success rate. So, but the panic and propaganda projected as if this is a very, very lethal virus, this is an existential crisis. But the data was not showing that. Nobody was paying attention to the data. I started with a mythology, Norse mythology. Thor, it is about Thor, the god of thunder and lightning. In Norse mythology, stood in front of the giant king. Pride was at stake. The king asked a drinking horn to be placed before Thor, challenging him to empty it. Thor picked up the goblet and took one long gulp after another. But no matter how deeply and how much he drank, he found his breath running out with the drinking horn still almost full. He kept on making fast and furious attempts to drain the goblet, but all in vain. The level did sink in the vessel, but he could not empty it. He was given a challenge by the giant king, or the god in mythology, and his friends were taken captive, and they were given a challenge to empty the goblet. Thor was asked to drink from the goblet and empty it, and he could not. He kept on trying. Thor was perplexed. Wrapped up in his own confusion, he did not notice the anxiety in the king's demeanor. What had been handed to Thor was not a simple goblet. By trickery, the horn was connected to the nearest ocean, and Thor had come close to draining the ocean. Unknowingly, he was attempting the impossible. The lower end of the goblet was connected to the ocean, and he wasn't aware of it. So, this story is from ancient mythology. Are we, in trying to drain the novel coronavirus from the globe, living in a similar challenge as Thor faced while trying to drain the goblet? Are we too attempting the impossible? Idea was that howsoever contact tracing one carried out, the iceberg, the hidden infections was 100 times more. And it was just not possible to identify all people with the virus. Most of them were asymptomatic, and it wasn't required also. So I have taken our country as India. India is an ocean of people, and most have recovered from natural infection with the coronavirus. The recommended strategy of test, trace, and isolate hardly made any dent on the spread of infection or identifying all with the infection. It's like Thor trying to empty the ocean. Only a fraction of infections were identified by these methods to break the chain of transmission and drain the reservoir of the virus in the community. The June 2021 round of survey conducted by Indian Council of Medical Research showed that 67.6% of Indians had antibodies. From this, we can infer that staggering 92 crores plus had developed immunity either due to natural infection mostly or in part due to vaccination. Around that time, less than 20% of the population had taken a single dose and only 5% were vaccinated. So majority, more than 90 crore people had already had the virus from natural infection. 90 crore, and around the time the survey, so we can assume that 75 crores people in a country had acquired immunity from having recovered from natural infection. The cases identified by the test, trace, isolate strategy stood at a minuscule of 3 crores. That time our case count was 3 crore, and as per the Zero survey, about 75 crore people had already got the infection. So out of the 75 crore, we could only identify 3 crore. So did it make any impact on the chain of transmission? It didn't. So by intense contact tracing, efforts of Herculean proportions, or can we say Thorian proportions, we had been able to detect only 4% of the cases in the country at this point of time. The novel coronavirus is the dawn of all viruses, not only difficult but impossible to catch up with. And like all successful dawns, it ruled more by fear and panic rather than lethality alone. The panic and fear also contributed to deaths from this virus, as brought out in a recent peer-reviewed paper published in July 2021 issue of Public Health Research, Practice and Policy by Compania and colleagues. Among 5,40,667 adults hospitalized with COVID-19, the researchers tried to identify the risk factors for severe outcome and deaths. To their surprise, the investigators found anxiety and fear-related disorders to be the second highest risk factor after obesity, leading to deaths from COVID-19. The panic also contributed a lot to death. Scientists advising the government lost the plot early. Testing and tracing are important in the early stages of an outbreak when it is localized, stream, and has not merged into the ocean of humanity. Or at the end of the pandemic when it has reduced to a puddle. That is, if public health problem associated with the disease still demands eradication. Else the puddle can be left alone. We have so many uncleared and bigger puddles in our country that, such as tuberculosis, which kill 1,200 every day, child deaths 2,000 every day, typhoid, which does not have a proper surveillance and counting system in place. But the estimated burden is appreciable in spite of an effective vaccine and so on. Typhoid, we have a vaccine, but still it's a public health problem and without a proper data system. Not only the futility of it, what about the cost of these futile measures when the stream had merged with the ocean of community transmission? What about the opportunity cost? What about the fear, stigma, and harassment of quarantine among those randomly picked up in the goblet, while the bulk of those harboring the virus were in the ocean of humanity in a densely populated country? There was no rationale catching a few people and contact tracing where the majority are in the community. First, let us consider the futility and utility of testing and tracing. From the scientific perspective, testing and tracing does not make any sense once community transmission has set in. Even if the number of tests had been increased 10 times, still we would have missed the bulk of positive cases which occurred in our country as revealed by the latest Zero survey. On the other hand, aggressive testing and tracing and quarantining have great utility to increase the case counts and generate panic and fear among the people. People harbor so many viruses and bacteria in their throat, gut, skin, some of which cause far more serious disease than COVID-19. But So never in history of medicine were people labeled as cases on basis of disease-causing pathogens isolated from them without any symptoms as was done from COVID or COVID-19. The ensuing panic of rising case counts is explained by vested interests to promote dubious treatments and preventives, all assured of over 99% success rates given the low infection fatality rate of 0.01 of the lethal virus. What about the cost? It has been estimated that the cost of contact tracing in the USA was $3.6 billion. India's population is 3 times that of USA, so the approximate cost of contact tracing and quarantining of a country would be around $14 billion. Can we afford this amount for where we are not achieving anything? Had we used this money to bolster the public health infrastructure to manage moderate to severe cases, our mortality rate would have been much lower in the second wave. So idea is that this is also one of the major blunder. This should be identified as a major blunder in the pandemic which we had. That is the testing, tracing, and not knowing when to stop it. We're not knowing when to only test the symptomatic and leave the asymptomatic alone. This should be a point to be noted to avoid in this strategy in future pandemics. That's all in this chapter. Thank you.